Actually, when we gathered as a family to discuss how we were going to support Mom, and talked about some of the signs along the way, they were actually there and we didn't see them. She had a couple of accidents where she didn't see potholes, scraped in the parking lot. She had fallen probably 3 or 4 times throughout the year and always fell on her face. Normally when someone falls and they know they're going to fall, they put their hand out to break their fall. So, and there's a lot of times hand injuries. Well, when we actually got her everything evaluated, what we found out was she was on too much blood pressure medication because she had lost some weight. And those physical changes, along with the mental changes that were already occurring in her brain cognitively, really put her at a disadvantage.
Is this something like a blackout that
actually
occurs when they fall?
Yes, that's correct. She would black out when she stood up because her blood pressure would get too low and she would just tumble like a tree.
Because a lot of senior citizens are very angry when they're told to take another type, not a pill, but medication. And sometimes it is not explained to them that it's needed to counteract something else in their system.
That's true. You just have to ask a lot of questions and really educate yourself about medications. As I said before, they can be very beneficial, but they can also be harmful.
Well, I think we need to hear about that in the high schools, because I think kids, and I'm thinking back to my own childhood and of my own children, in the high school years, they're very, very receptive, and they'll pick up things quicker, and they won't forget them, perhaps for the rest of their lives. But if it gives them even an indication that these are something they should look out for, it would help.
That's a very good point. And if you think about what you see on TV, you can't watch an entire program without having some kind of medical commercial for some product.
You have to have a 10-pound bag of salt.
Absolutely.
When you hear the commercials, because it can get pretty bad.
Now, how prevalent, Deb, are falls in the later stages?
Vary. We find that in the middle stage of dementia, people are losing their ability to control their muscle groups. Spatially, it's hard to judge where you are. Someone may see something on the ground and perceive it as a stair when it's not even there. So we do give our residents that are in our facilities a lot of assistance with keeping strong, trying to maintain safety issues. If folks are at home, they can do certain things to make their house more safe, declutter, get rid of all the junk that's laying around. Don't have throw rugs laying around that you can misinterpret. And especially in the later stages, even color discrepancies are very important to them. So,
is some of it just loss of the sense of balance?
It affects your entire brain. Your brain doesn't even know how to clarify or figure out what that signal is. The signals just get all jumbled up. If you can think of a group of wires, like you've seen telephone wire that gets all mushed up, rather than having nice pathways like straight streets, these pathways in your brain just get all tangled up. So how can it make a good judgment when it doesn't really have the right equipment?
So it isn't just the individual who has the dementia problem. Everyone in their family is involved in it.
Absolutely.
So when you say education, Jean, you are so right.
Yeah, that's one of the things that we do at Christian Cares. We make sure and educate our families on not only all the stages of a dementia or a cognitive process, but what we try to get them prepared as to what could happen. Not only as far as falls goes, but some of the other physical issues that goes along with that, such as problems swallowing and drinking. There could be some incontinency issues. There could also be
even going to the bathroom. You know, for us it's natural, but if you think about how many steps are involved in just using the restroom, many. First you have to get there, then you have to pull down your trousers, sit down. You think of all of that, you can see how difficult. So anything that involves complex decision making, even brushing your teeth, they don't know how to do that anymore. They just forget. For a while we can cue them, but at some point even telling them what to do doesn't work anymore.
Well, when it hits this, I know we keep going back and forth, but when it hits this latter stage of dementia, what do you do for your parent or whoever it happens to be?
Well,
Who's supposed to take care of them? How do they take care of them?
many families care for their loved one at home, but it's a 24-hour job, 7 days a week, 365 days a year, and it can be very exhausting. Sometimes families just don't have the resources. They may have to work and they may have to find other suitable arrangements like a nursing center or some place that they can get some help. There's a lot of guilt involved in that. You want to take care of your mom and dad as much as possible, but it's really hard to turn that over to someone else. It's difficult.
So when they come to, when they are at that point, when the families are at that point and they turn it over to, they bring their loved one to us, we have different kinds of interventions. We call them interventions, things that we can do to help provide for their safety and for their overall needs. Not only do we have nursing staff that are there, and we have certified nurses' aides that are there, but there are also other things that we can put into practice that are the standards of practice across the medical field, like for falls, we have certain items that we can put next to their beds to help break their falls if they're continuing to want to fall. If they're having swallowing and drinking problems, besides getting the right specialist involved, like a speech or a swallowing therapist, we can alter their liquids. We can make them thicker so that the swallowing mechanism gets a chance to work a little bit. We can alter their food consistency, again, so that they can swallow and try to chew. And we can also look at certain incontinency products that are at our disposal too.
Well, it's a bigger field than you'd ever guess. To take one little word called dementia and elaborate the way you ladies have done. And I have a feeling we could probably talk for hours and weeks and months.
We could, because
and
Jean,
never hit the end.
Absolutely. Jean just touched on the physical. There's the whole emotional side and making connections. I guess at the late stage, what we would hope is that every encounter that you make with your loved one or that we make on your behalf would be a good one. It would be gentle and loving, high touch. We've had some great success using aromatherapy, quiet music, all of those wonderful things. And our goal at that point would be to make that moment matter to them.
So that they are always comfortable.
Absolutely.
Well, ladies, thanks so much.
Welcome.
Thank you, Jean.
Thank you.
And West Michigan, stick around because we have some of the best people coming on, and these are just the start. See you later.